Hello, everyone. Welcome to CPT Final Frontier podcast. I am Shivangi, your CPT guide at CPT Final Frontier, the premier exam preparation course. Visit our website www.cpteff.com to enroll in our courses today. Hello, everyone. Welcome to CPTE Final Frontier Clinical Series podcast episode. Today, we are going to solve a case with Mr. Ravneet Singh. He's going to walk us through all the different options and help us to pick the correct answer. So, let's hear this out.
Greetings, everyone. Welcome to the clinical series of CPT Final Frontier podcast. I'm Ravneet Singh, one of the lead instructors and your co-founder for CPTE Final Frontier. Today, we are going to discuss about one of the mapping questions that was launched by the CAPR. We'll be discussing a vignette, which has 3 questions, and we'll be solving those 3 questions. We'll discuss how to best practice on solving the multiple choice questions. And we'll also talk about how to work on the content so that you have the best ability to score the maximum in your written CPTE exam. So let's dive into it. All right, now you see a question on your screen, or I'm going to read the question for everyone. Now, this is a vignette which is based upon a pediatric area of practice, and this is a case of congenital muscular torticollis. All right, so I just want to remind you, anytime we solve a vignette, anytime you are working on a vignette type of questions in your exam, try to read the question first so that you can understand the goal of the question, right? So question number 1 says, on palpation, the therapist finds tightness of the left sternocleidomastoid muscle. Which of the following positions would the baby most probably maintain his head in? It's a 3-month-old baby with a diagnosis of congenital muscular torticollis, requires physiotherapy in an outpatient department. Now, from the question, we understood that it's an infant, right? It's the age of the baby is 3 months. And now you know that it's a left side torticollis. How do I know if it's left side torticollis? Because the question mentions that there's a tightness in the left sternocleidomastoid. The options are right lateral flexion and rotation to the right. Option B, right lateral flexion and rotation to the left. Option C, left lateral flexion and rotation to the right. And option D, left lateral flexion and rotation to the right. Now, there are 2 ways to solve this question. First way is, are you confident enough with the content, right? In your head, you're thinking about it's a left side torticollis, it's a left side sternocleidomastoid, so it has to be left side lateral flexion, right? And you're right on that. So the first thing that you need to know about this question and how do you best solve this question is by understanding the content, right? So left torticollis means left side lateral rotation, left side lateral flexion, left side lateral flexion, right? So if you look at option A, it says right lateral flexion. That is not going to be the right answer. And I'm going to eliminate that. I don't even have to look at this option because the first half of this option is not right. Then you have right lateral flexion, option B, and rotation to the left. Again, this is going to be eliminated because the first half of this option is also not right. Now we're left with option C and option D, left lateral flexion and rotation to the left. Option D says left lateral flexion and rotation to the right. The correct answer to this question would be option D. The function of the sternocleidomastoid would be same side flexion and opposite side rotation, ipsilateral side flexion and opposite contralateral rotation. If this patient has tightness of the left sternocleidomastoid muscle, your answer should be left lateral flexion and rotation to the right, which is option D. I hope that makes sense. Now we're moving on to the second question of this vignette, which says, the physiotherapist teaches a home program to the baby's parents. Which of the following instructions should be emphasized? Now, we already know that this patient is 3 months old and has a congenital muscular torticollis. Now, you're working on teaching the home program to the parents, right? Option A, incorporating the exercises into the child's daily routine. Option B, pursuing the exercises intensively at frequent intervals during the day. Option C, carrying out the exercises only when the child is awake and can participate. Option D, doing the exercises only when the child is asleep. Now, in order to answer this question, as a therapist, you want to think about, hey, this patient has spasticity, right? This patient has congenital muscular torticollis, which means either spasticity or tightness on one particular side. And that tightness is throughout the day, right? It's not more in the morning or more in the evening. This is not how it works, right? So let's look at option by option. Incorporating the exercises into the child's daily routine. It basically means that you're going to build a routine around the child so that you're also treating the torticollis. For example, if it's a left side flexion and right rotation, you're going to play with the child on the right side so that they can tilt the head on the right side. If you're feeding the baby, you want to feed on opposite side rotation or same side rotation. You want to feed them on the same side rotation because you want the left rotation. And that's part of the daily routine as well. So it basically means that you're going to build a routine which also helps you to reduce the effects of the torticollis, and the patient should be able to do something functional, right? Option B says pursuing the exercises intensively at frequent intervals during the day, right? So you're going to decide few minutes and hours during the day where you're going to work with the baby. That's what it says. Option C says carrying out exercises only when the child is awake and can participate. Now, this particular option is not bad, but now you have to think about, are you not going to position the baby when they are at sleep? Right? So option C takes your opportunity to treat the baby during their sleep. And that's a big chunk of amount of time in a 3-month-old baby. Option D says doing the exercises only when the child is asleep. Now, when we spoke about option C, that you're taking the opportunity to work with the baby during their sleep, is exactly opposite what option D is. You're taking the opportunity when the baby is not sleeping and can actually participate in some activities. This is a 3-month-old baby, right? Now, for a 3-month-old baby, maybe you can use some colorful things. Maybe you can do some rolling techniques to help this baby out. So if you're just waiting for the baby to sleep, or if you're just working with the baby while they're awake, that is not enough for this particular problem. So option A would make more sense, that you want to incorporate the maximum physiotherapy techniques or exercises during the child's daily routine, whether it's during waking hours or during sleep. All right, I hope you guys are doing well. Let's move on to the third question. And the third question says, and the vignette is going to be the same, the case is going to be the same, where you have a 3-month-old boy with a congenital muscular torticollis. And we already know that it's a left side torticollis, right? Question 3 says the baby's torticollis improves with physiotherapy treatment. However, a follow-up assessment at 8 months of age reveals a motor delay. Which of the following assessment tools should the therapist use to determine the child's motor performance in relation to his peers? Now, this is a question based upon your outcome measures. So you want to base, the goal of the question is that you're going to compare the performance of this 8-month-old boy to 8-month-old boy without torticollis, and if they're able and how much they're able to perform the motor tasks. Option A, Alberta Infant Motor Scale, AIMS. Option B, Gross Motor Function Measure, GMFM. Option C, Ashworth Scale. And option D, Functional Independence Measure. Questions like this, where you need to have very strong content. For example, if you don't know what these outcome measures are, there's no way you can answer these questions. And elimination method works the best in these kind of questions. Why? Now think about it. When you're looking at the performance based on the age, you don't want to think about the Ashworth scale, because Ashworth scale is strictly about spasticity, right? If the spasticity is higher, definitely the patient's performance is going to be different, and it has nothing to do with the age. Option D says functional independence measure, which means that you want to find out how much help the patients needed. Do they need min assist? Do they need mod assist? Are they contact guard assist? And that is not something that you can compare with the age, right? So there are two scales left, option A and option B. Option A and B depends upon the age, and that's where you want to choose something about. Now, let's say in a universe where you don't know about these scales, and I hope that doesn't happen during the exam, but let's say if you're not very sure about which scale that I'm going to use, let's look at their names. Alberta Infant Motor Scale or Gross Motor Function Measure. It's an 8 months old patient. Now you want to think about what an 8-month-old can do. Can they do fine motors? Can they do motor functions? Are they still infants, or are they into an age where they have a lot of control in their body? For example, 8 months old baby should be able to sit without the support, right? 8 months old baby should be able to roll section by section. It should not be just neck over body, but it should be body segment separately, right? 8 months old baby should be able to do quadruped position, right? 8 months old baby should have a good palmar control, right? Which means that they have the ability to release the objects from their hands. So you want to think about the milestones in this case, because the question says, however, a follow-up assessment at 8 months of age reveals a motor delay. Now, what you need to know about these two scales is at what age do they work? Till what age Alberta Infant Motor Scale would work, and till what age Gross Motor Function Measure works. I'll tell you an easy way to solve this question. GMFM starts at 4.5 years. And there are a lot of components. I'm going to attach a document in the description where you can read about these scales, these 4 options, so that you know the context behind it, and you should be able to make your decision in future questions. When I'm able to eliminate these options, I'm only left with option A. Now that's where the magic happens in the exam. You're not sure about which option is right, but you're definitely sure about option C and D are not the right answers. You also know option B starts at 4.5 years, but you're not sure about if option A, AIMS, is going to be my right answer. But that doesn't matter. You don't have to be 100% sure if that's going to be your right answer or not, because you know other options are definitely not right. So congratulations, you got the answer right and you got the points, and you're one step closer to pass your exam. All right, very good. So we discussed about the congenital torticollis in this case, and we talked about the position of the patient. We talked about the priority and how to make decisions for exercises. And we also talked about the outcome measures of that could be related and that could be related with the patient's age. I hope it helps. I'll see you in the next clinical series.
Thank you, Mr. Ravneet Singh. That was a great case to solve today. So, that's all for today, my friends. Join us next time for another Clinical Series podcast. Have a good day. Thank you for joining today. Reach out to us, support at cpteff.com. Follow us on social media on Facebook, Instagram, and YouTube for more content. Till then, keep listening, keep learning.